This presentation is about anaphylactic shock in the fluoro department in radiography. Anaphylactic shock is the allergic reaction that occurs due to iodinated contrast media being injected into the blood vessel, pushing water out. Why does this occur? Because the molecular structure of the contrast media may not be compatible to the patient's body chemistry. This also causes increased uptake in fluids going into the cells. Reaction levels to anaphylactic shock can range from mild to moderate to severe. With skin, they may experience rash, redness, hives, warmth of skin, or itching. Moderate leads to gastrointestinal issues such as nausea, stomach pains, cramps, vomiting, or diarrhea. They may experience respiratory distress such as coughing, wheezing, shortness of breath, chest pain and tightness, or a hoarse voice. Severe anaphylactic shock experiences cardiovascular stress such as dizziness. The patient may appear pale, have a weak pulse, fainted, or gone into shock. Neurologically, they could be experiencing anxiety, a feeling of impending doom, or headaches. While not all reactions are the same for each patient, if a patient has had a previous reaction, they may react differently than last time. Contraindications that should be noted are patients on IL-2 or have received in the past can have a delayed reaction within several hours of receiving iodinated contrast. IL-2 is used in patients to treat cancer of the kidneys and melanoma. Barium sulfate should not be given to patients who have had recent surgery to the thorax or abdomen, or may have a small bowel obstruction, as well as a perforation. This can cause leakage of the barium sulfate into the body cavity. When this occurs, flocculation of barium sulfate hardens like concrete and must be surgically removed. Patients that have any sort of kidney problems need to be contraindicated because renal failure due to overworking the kidneys can occur. We just received Miss Smith from the waiting room. Her history was taken, LMP and waiver were signed, and patient did not have any previous contrast reactions.
Hi, Ms. Smith. My name is Dr. Harris. I'm going to be the radiologist today. I'm going to be performing your fluoro exam. And right here is my tech. She's going to be assisting me today, okay? So I'm going to go ahead and administer some contrast. You're going to feel a little weird, but that's all right. That's a little normal. If you feel anything that's out of normal, I need to know, okay? All right.
Feel that? Great.
I see you have some redness. Let me see this real quick. Does that hurt?
Doesn't feel good at all.
All right, just relax. Just relax.
Can you breathe? Miss Smith?
Cold blue. All right, here's epinephrine or epinephrine.
2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13. You okay? How you feeling? Are you with us?
Thanks to the quick efforts of the code team, the patient was saved. The team administered epinephrine that reversed the anaphylactic shock. Patient made a full recovery. Therefore, it is important to take a thorough patient history and make sure there are no contraindications for the exam. It was not noted that 3 weeks ahead, Miss Smith had her appendix removed.